the more questions that you guys ask, the better your treatment plan is going to be for your patient. Okay, you're not only gathering information on where we are and how we got there, but where the patient's condition will more likely take us. I love that statement. I think that's very powerful if you actually think about it. You need to have a plan and prepare those steps, right? Because if your patient is truly in a respiratory distress situation, they can go into respiratory failure really quick, and then we have a whole new set of problems. And you guys had better have already predicted that before that happens, so that you guys try to do your best to stay ahead of that 8-ball that the patient is presenting to us. We're talking about the actual incident and illness, okay? If we are not asking the right questions, if we are stalling on scene, remember we are already behind the 8-ball on 90% of our respiratory patients. If we're not looking for distress, if we're not thinking about failure, the longer it takes us to actually intervene for our patient, specifically when it comes to the respiratory disease patterns, the more likely the outcome is going to be bad for our patient. Over the respiratory distress versus failure, we've covered that in other areas, and I think that you guys, as long as you guys are listening to lectures and you're reading up onto it, you guys will have a good handle on it. However, when we're talking about arrest, if we've already shown up on scene and of course the patient's already in arrest, or we witness them going to arrest, basically we're talking about the definition of arrest on this slide, which is a loss of respiratory function. And then if we go into respiratory arrest, we're going to start putting a lot of stress in our cardiovascular system, specifically our heart. Our heart's going to start pumping faster and faster and faster in order to try to keep up with the demand of the body, and eventually it's going to stop and the patient's going to go into cardiac arrest. So to conclude this lecture, okay, please remember that our respiratory assessment starts as soon as we lay eyes on the patient. You guys need to start gathering up that information and really kind of decide if we are starting in a difficult, if we're in distress, failure, or arrest, and then we need to find out if we're going to be dealing with a difficult airway or not. Okay, we want to make sure that we are using all of our tools. We're taking a good set of vital signs and we're reassessing our patient frequently when it comes to respiratory. Some of the basic tools that we're using, obviously, is our end tidal CO2 and our pulse ox, okay, along with our auscultation of lung sounds. Please, please, please make sure that you guys are listening to those breath sound videos in your breath sounds modules. That's all that module is a bunch of video recordings for you guys to listen over, and there's plenty more online for you guys if you guys just actually Google it, okay? And you guys can Google by specific disease patterns in order to see if you can find the lung sounds to kind of help you guys out with that. The other thing is make sure that you guys do get your sample quickly, okay? Specifically with the respiratory patient, we want to try to get as much information from them before they do end up having altermentation, if we believe that's the route that they are going in, okay? And remember that the OPQRSTU is not just for pain. This can be used for the patient to describe their symptoms of their respiratory illness or respiratory pattern that they're dealing with. And the more questions that you guys ask, the better are you going to be in order to treat your patient accordingly, all right, and actually develop a couple of different differential diagnoses yourself, okay? And I really think that's part of the key of actually differentiating between cardiac and respiratory, which is really the hard thing that you guys are going to have to learn this semester. There's a difference between cardiac and respiratory emergencies. And the more questions that you ask, and this is true for cardiac as well, you guys are going to get some pertinent questions on what you guys might want to be asking for cardiac, okay? You guys are going to kind of pull some questions out of the respiratory, pull some questions out of the cardiac once you guys get comfortable, and based on those questions that you guys ask, you guys can really kind of develop excuse me, you guys can really kind of develop a differential diagnosis and a treatment plan for your patient. As always, please make sure that you guys watch the videos. in this module, and I will see you guys next lecture. Email me if you guys have any questions. Thanks, guys.